new thing. Okay. All right. So, welcome to Success, also known as You Got This. I always have to, we can change the names. That's kind of cool. Huh? What? And you guys have all, I'm guessing, been in the course. So we've got the Q&A that's always open. If you have questions or you need me to update anything or more than one thing. There's also the APA formatting for 7th edition resource there if you need it. And many of you did, some of you didn't do like the time management stuff, the time management wasters and time management, like how to keep track of your time, what you're spending the majority of your time on. We're not going to do that. If some of the new students want to, I can review that with you if you need help trying to figure out your time management. It may take another week or two to kind of figure out where you need help with your time management, but I'm happy to do that as well. You also have the syllabus that has like everything else has in it. The handbook, student support services. I highly encourage you, if you feel like you need an assessment from DSPS, Panther Labs is great. They'll help write papers. They'll help with APA formatting, library, all that kind of stuff. Like, I'm not sure that nursing students take advantage enough of those resources. So that's why that link is there. And please, literally, like math, they have math people that will help you do math nursing problems, the conversions. They have people that will proofread papers for you. You could take your community paper to them or your PCOT project, and they'll proof them. They'll go show you how to write them. They'll do the APA format and such, right? So you don't be an island, like you have that available. They can schedule you. Your whole group could go in and be with somebody. Yeah. For this class in particular, there is a module. There's a pre-course reflection, which is due next week. This is very similar to what you did in first semester. Sorry. Again, the assignments are meant to go back to a student learning outcome for the course, because we're being looked at by our accrediting bodies. So it's not just all skills, it's other stuff as well. So plus, especially the pre-course reflection lets me know where to focus, right? And so self-reflection, 1 to 2 paragraphs, write about what you hope to learn and gain from the second semester success course, 3 things you hope to learn and gain. Why is it important? Take into account last semester, those of you that were here before, how have you grown? If it's, if you're new, that's fine to say I'm new and I'm terrified. What scares you the most? How's your life going to change now that you're in nursing school for those coming in to nursing school? It's a big shift. And where do you anticipate needing help? That's what I need to know. Where can I help you? I think the skills piece is good, but we can review pharm, we can review theory, we can but you have to tell me, because I don't know what's working you. I can guess, and I'm maybe 50-50, but and you don't have to do APA formatting on that. Just answer those questions. It's like 5 points and you're good to go. And then there will be an end of course reflection. That's like the end. We're probably done, I want to say week 14 or 15. So there'll be an end of course reflection. You also have your teaching demo like we did last semester, those of you that stayed till the end. So you're going to choose, is that the roof? That's kind of scary. Okay. So choose. Wow, that was pretty loud. So you want to choose intervention, med admin, assessment, something that is causing you stress to perform. It can be from first or second semester, preferably second, but it could be from first. And you're going to demonstrate by teaching it to each other. And then the students that you're, giving are going to give you feedback on it, right? But this is going to be skills from week 1 through 11. And then starting in week 7, so you have time to decide, because we'll have gotten week 7, we get to CVAD dressings, and we'll have venipuncture in there. And then you're going to decide in your group who's going to do which skills, so we don't double dip on skills. It'd be better, instead of 3 postpartum assessments, 1 postpartum, 1 CVAD, 1 NG, or so everybody gets to experience the different skills. Yeah, and that will help to prepare you for the practicum for 57, because in skills, there's only a final practicum, not a midterm practicum. So you're going to practice the skills, and then you'll have the final practicum. So this is in preparation for that. I'm expecting somebody to like fall through the roof. I don't know. And then, yeah, so that's the skills. So you don't necessarily have that, that'll be later. And it's really doing this is how you're gonna, right? Because you're gonna be in groups, right? So that your skills. We'll go over it later, but that's what you're gonna turn in for your group to show that you've all completed, right? Instead of just random, I think it's better to put you in groups, and then it's not as random. It's like intentional and thoughtful for which skills you're going to demonstrate. And then new this semester is writing test questions. So every week, yeah, 4, 5, 6, 7, 8, 9, not week 10. So we don't have class week 10, 11 and 12. Writing test questions that relate to the concept of the week. And so it's better than making you do ATI modules, unless you'd rather do ATI modules. You sure? Maybe, I don't know. It's 2 questions. So for each week listed, you're going to write 2 exam questions, right? This is a way to look at, remember when we do quiz review, right? What was the question actually asking? What did the question want to know that you know, right? So by writing questions, it gives you that background for it. So for example, for week 4, week 5, let's see, what do we want to do? Week 4, health promotion, newborn adaptations. Actually, let's take week 3. So because we're in week 3 right now. So based on the lecture that you just listened to and participated in about dehydration, what kind of concepts or topics might there be a quiz or test question, exam question on? Signs and symptoms of dehydration. Expected urinary output. Yeah, calculating any of those urine outputs, those type of things. What about nursing interventions, right? Nursing interventions. So signs and symptoms. Let's put signs and symptoms of dehydration into a question. How would you write that question? Or there's different ways of doing it, but what's one way? Usually you have a nurse and you have a patient, and then they're doing something, or the nurse is teaching a family. Could be something based off the Swift River that we did. The nurse is caring for a 4-year-old who has been brought to the emergency room for dehydration. The nurse would expect to see the following signs and symptoms of dehydration. Select all that apply. Ooh. Or, something like that. Does that make sense? So that's what I'm asking you to do then, is to take a concept, take something like that, the calculation, right? You would look at similar to what was on the slide, based on the age. Is this an expected urine output, right? There you go. Oh, it'd be nice if I added a rubric. Okay. And then what we can do is when we have our check-ins, we can review the questions. I can post them. I can take all the questions from that week and make like a mini quiz practice quiz and post it. Right? Because what you will need to do is provide rationales for your correct answers, right? Why those are the correct answers, right? And then we can help each other with that. I mean, if everybody in here writes 2 questions, it's like 50 questions. I mean, some are probably going to be duplicates in some way, shape, or form, but still, the more questions you practice, the more you go into ATI and do the adaptive quizzing, set up your own quizzes, that kind of stuff. I'm still working on it. I'll play with it some more. If I can get it to email to you guys or send to you guys, I can do that. But I think the more and more test questions you do, the more prepared you are to figure it out. Yeah, maybe, hopefully. Okay. Assignments. No, those are just extras. I don't care about those. And so we're not going to have check-ins every Monday, right? I chose Mondays, at least for today. If you prefer, I don't even know when on Thursday we would do it because we're 3 to 5 there. So, I mean, I'm happy to do something Tuesday or Wednesday after clinical, but y'all are tired. I'm tired. It's just really difficult. So that's why I wanted to offer Zoom. So we have, and it should tell us, right, week 3, so there's a Zoom, and then the 2-hour lab. So as you go through each week, like for example, week 4, there's only the lab, there's not a check-in on Monday, okay? And then in week 5, there's a 1-hour Zoom, and then the 2-hour labs. The reason that there is a Zoom in week 5 is because what happens in week 6? Exam 1. Right? So I want to make sure. Oh my gosh, yes. You know, I try. No. And so I want to make sure you guys are on the right track for that. So that's why there'll be a check-in and then week 6, in case there's other questions about the exams. Does that make sense? So on those Monday check-ins, I have this room reserved, so we can do that, but I can also Zoom, or like some of the students are doing their like driving or whatever, and they're on Zoom with me. I record it. It'll take a day to kind of get it posted, but that will count. So you don't have to physically necessarily be here. Sam. Oh, are we? Well, that's probably why it says TBD. 1 week 5. Oh, I'm looking at the modules. Sorry. When I put the syllabus together, I did not specifically know if it would be Mondays or not. That's why it says like TBD, as if a different time worked for you. I didn't want to assume that this time worked for you, because I want people to be able to come and get their questions answered. So we can do a different time on that Monday. We could do something in the evening if you want it, or we could do whatever. We'll think of something, because I want to make sure we could even do Friday. Not that you'd want to do Friday, but we could do a Friday Zoom, you know, as the exams on Monday. I don't know. I'm just saying, it's up to you to tell me what meets your needs. Okay, so for that week, if we're not in school on Monday, give me another time, because that's going to focus on exam prep, right? So if you want to do Thursday, you know, in the Thursday evening or Friday, you know, we could if you wanted. I just think that's a long time. I can do exam prep on that Thursday as well. We would just be short an hour someplace, so I'd have to move it. I don't really want to do 3 hours. I can, whatever meets your needs, or I can Zoom it. I can just do like a exam review thing. And what else? So that's kind of how, right? I'm trying to be as open to your needs a little bit better than last semester. I don't know if it's working or not, if it will work or not, but I thought I would give it a try. Because I don't want people to, oh my gosh, I have success at 1:30. But if you can Zoom, there you go, and get your questions answered and all that kind of stuff, then, you know, why not? Or look at the recording and then be like, you know, message me or hang out me or whatever and ask questions. Or even better, put them in the general discussion where everybody can see them. And then I can answer them and everybody has the same information. Yeah. And everybody, let's use it as a tool. That's what it's there for, right? I mean, if it's personal, Hangouts is fine. If it's like content related or something, or if you want, hey, I'm not sure, let me try my question out. Put your question there. Let's all like give feedback, right? We should be here to help each other, right? Not to like, ew, I don't know how to write questions. We have classes on how to write questions. It's not an easy thing. Does that make sense? Yeah, okay. Questions so far? Are we on time? Okay. Yes. Yes and no. We don't usually track success because it's success. Open Skills Lab is different. It requires you to track your hours. It's built in right now to have 28 hours in the course, and you're only required to have 27. So that gives you an hour someplace to not come. But if you come to everything, which is well, take attendance as well, you should hit your 27 hours, knowing that the Zoom is counting as an hour, whether you're here or not. So that's sort of your little gift there, if you will. Yes. Yes, please. I would appreciate that, because then, right? But if you're going to Zoom, you're going to be on the Zoom, I can see that you're there. If not, then I'll probably, give me 1 or 2 pointers from the class so I know that you at least watched the video, something like that. Because otherwise I won't know that you watched the video, the recording. We can on Thursdays from 3 to 5, somewhere in, I can't guarantee what I can get done in that amount of time, but yes. My thought would be priority, don't leave it to me, right? You have other people that can, test out. We have like 2 days, where you can test out. But I would love if people would practice like they were testing, and then I can provide feedback, or you can ask questions as you're going along. Because you're going to, with CVAD, you're going to get stuck on CVAD, some of you, or NG tubes, that's not so bad, but the CVAD or the venipuncture, right? Use it as time to like practice. But I can't, if it's like, oh my gosh, I forgot, or it's my second attempt or something. I would like second attempts. It'd be nice to have them done in here, because I can remediate you individually. Those of you that have had that, I think it's helpful. But we can do that. But I don't want to be like Open Skills Lab, where I've got a list of 20,000 people that want to test out on stuff. And we're working on getting an appointment calendar for Supervised Skills Lab. So that you guys can sign up for appointments, because Ms. Groner was saying that, especially with 3 different instructors, I think it's easier to have appointment slots, and then, which is how we used to do it pre-COVID. And then people, well, my name was first. Well, but it's erased. I don't know, but just would do appointments. And so hopefully that will work better. Good questions. Okay. Sometimes you will get the inside scoop on stuff in class. I think that was beneficial last semester. So I will attempt to do that as well. So for today, is there anything I need, again, you all to come to me with what you want me to cover, but is there anything confusing from development or anything last week that we covered, either in farm or in anything, right? Farm skills 56. I know this is awkward because you haven't really put pre-thought into it, but moving forward, like, bring questions, or if something's confusing, then let's talk about it, right? I think you guys are working on your developmental groups. That was good. The case studies are pretty good in farm. I'm just trying to be consistent with the grading, because not everybody put like the same medications. I was kind of expecting some things, and then other things got thrown. I'm like, oh, okay, hadn't thought about that. And some people aren't answering all the questions. So I'm trying to be consistent in my grading. So I got about 12 done so far, and I'm going to keep on plugging through. But for the most part, they're good. You guys were answering the questions, putting thought into it. Oh my gosh, I totally forgot to tell the class, your baby Brianna discussion posts. Oh my gosh. This is probably, I kid you not, one of the best discussions. And I've been teaching here for 8 years, and I have discussions in every class that I teach, generally speaking. This is the best discussion I have ever seen. You guys are putting so much time, thought, effort into this discussion. It makes me even tear up now thinking about it, because it's a tough topic. And you guys are being respectful. Your responses to each other aren't just one-liners, like you're going in. This is what a discussion is supposed to look like. If you ever wanted to know, this is it. This is the goal for what it is right now. So I just wanted to commend you on that. It's just really the research and the thought process, because I can see the thought process when I read through your posts, the things that you're thinking about developmentally in the systems and the laws. Like Sam has all this, law, like you should be a nurse lawyer or something. Like she's gone and looked up all these, the cases, the case laws, and all those kind of things. And where did we, did they have prenatal visits? Where did they go? Like, where was their follow-up? Like, where were the post visits? Did she go to her visit? Did the baby obviously didn't go to any visits? I don't think. Right. But, and then what about the neighbors? What about, why is the community? Because they, either feel guilty or responsible, or, it's blowing me away. It's amazing. So I just want to say thank you. You guys are doing an awesome job. I'm hoping that the 2-week time frame helps to get the one and then go back and do your responses. It's amazing. I just want to tell you, I'm so proud of you. You got it. What else from last week? Anything in farm? Like I updated the med list. Or think about it. We can put it in the Q&A, and we can look at it the next time we get together. We're doing the fluids and electrolytes. Hopefully you guys like the Swift River. I think it's better. The case we had in ATI, it's a client with dehydration and gastroenteritis, and they're nice. You watch these little video snippets, like I could have you guys do it, but there's not really a compare contrast, or I don't feel there's as many opportunities like you're watching it. And then it asks you like one question, and then you go to the next thing. So I like that. Safe medicate. How's safe medicate going? I know you wish you had more time.
I mentioned more like you just got thrown some more things.
Yeah. Yeah. I think I told you last week that there would be, I would probably post something that was similar. So, but the math is making sense. And now you can see the output. That's not going to be on Safe Medicate, but you can see how the output and the intake, like how that's going to work, especially for peds, right? How that's going to work. Let's see, questions on, you're going to talk on Thursday with Ms. Clark. You're going to go over gestational diabetes and thyroid. I think you have a case study for that. So if you have questions about gestational diabetes, the one key difference is it generally goes away after the baby's born, although it can last a little bit longer. It's also a precursor or indicator to have generally type 2 diabetes later on down the road, just so you know. And then you're probably gonna have to know like the glucose tolerance test, the tests that they do, like what's the time frame on that, and the levels, which I don't remember off the top of my head, but I'm sure they're in there somewhere for you. But those are what you're gonna know. So to go back and retest again if you get a certain level, and you have to stay and do it and all that. So you have to know those, I'm sure. Yes.
So with the oral glucose tolerance test, so the first one, for like a normal pregnancy where the woman or the person is not at risk for gestational diabetes, is the first one where you don't change your diet at all. So you can still eat breakfast even before you take the glucose tolerance test.
On the 1 hour?
Yeah, for the 1 hour.
That's a screening, not the, so it goes labs, like you get blood drawn, and then they're like, oh, maybe you get sent, maybe you don't get sent, or do you always get the 1 hour?
I don't, Ms. Clark would know that. I don't know as you always get the 1 hour. I
And
think,
then the 1 hour is the screening.
Yes,
It's screening everybody.
oh, it may have, that may be now
yes.
what it
When
is.
I have my son, they still make, for the 1 hour screening, they still have me fast. And but then when I look it up online, it's, I would see that you don't have to fast, so I'm just confused.
In our literature, they're not good.
So I'm just like, wait.
I wonder if they told you misinformation? Because I thought that one was like the screening, so it was like the normal whatever. And then if that comes back out of range, then they want a fasting glucose. It's almost like a random glucose kind of.
That's when you, or the 3 hours, like, you don't take coffee. And,
Yeah.
there was like a bunch of things that you couldn't do.
Well, that is that case study, that's for sure.
Mm-hmm. Exactly. And the case study in farm, I think, like there were questions on the quiz that came up from that as well. So I think there's a lot of, I think there's good information and things to learn from the case studies. And then it also makes you think, always be thinking, what information don't I have? What do I want to know? What do I need to know? Right. And then you'll go over thyroid, like hypo and hyperthyroid medications and how that affects the fetus and the mom and all that. So that'll be Thursday. And then let's see, what else? We reviewed the quizzes already, so we don't necessarily need to go over that. You got the query form, so you got that. What else in class? And then I'm going to move to clinical. Anything else I can help with? If you think of something, either ask or put it in the discussion. Okay, clinical. As soon as I get done here, I'm gonna get everything posted. Is anybody going to Schilling to EDS tomorrow? Can I give you the forms to turn in to the lady? Please. Thank you. Yeah. I've not heard from Miss Heinrich yet. Maybe. No. Okay. So I'll call her after, but I'll get everything posted. Clinical uniforms. I'm excited. I was talking with Ms. Clark, and she wanted me to let you know that if who's ever going to be with her for sure, the postpartum newborn, as you get there, you don't have to necessarily do the newborn, right? But postpartum, we only have 6 days with you, right? In OB, right? And so we're trying to get you through labor and delivery because we want you all to see a delivery, some kind of delivery, right? And then postpartum NICU, hopefully, if we can. Some of you be going to antenatal. I know people at Natividad, it's going to take us a while to get, into the computer and all that. But Ms. Clark's expectation is because you've been at SVMH, except for any new students that are going with her, that you're going to be hitting the floor because you kind of know it's just a different. It's just a different patient population, right? One of the things I know for both, especially Natividad, y'all have to be eager. Y'all have to be, you can't be timid. You've got to seek out your own learning opportunities. And I was specifically told that at Natividad, like the nurses will go do their thing. And I did SVMH OB clinicals last year. They'll just go do their own thing. You have to stay with them, right? And communication is key. Like if we're going to pass meds or do something, we have to communicate but you've got to be, looking for those opportunities and ask, for it. Don't be like standing back, because you won't get much out of it if you just stand back. But that's what I've been told specifically. Know that the nurses, probably like nurses you've met before, are like, they like students are good, but they have particular ways the nurses have particular ways they like things done, right? And so they want to be really clear if it's a medication, if you're giving it or they're giving it, right? Or if it's some assessment, or like for postpartum assessment, they'll do their own assessment. Don't take it personally. They have to document that. Then we'll be doing our postpartum assessments and newborn assessments as well. But they're going to document their own. Yes. For what?
Like when we go to see God,
Yeah.
I usually, they just let us do vital medication.
You should have always been able to do assessments. You should be able to do your own student assessment.
Like we are able to physically do when we chart it.
Yeah, chart it.
They didn't let us. At least the first half of the semester.
Okay. Which clinical instructor? Huh. It could be the floor, or it could be the situation. I know in the past, they'll usually let you go in and do your own assessment, because it comes up as you charting it, you documenting it. So you've got the nurses documentation and the student nurse documentation. So I don't know. Yeah. Okay. I'm not. Yes. I don't know the answer to that. I know I can speak for Ms. Clark and myself that we would expect you to be able to document an assessment in the chart. Maybe not the first day, or hopefully the first day, or at least look at one. Yeah. But vitals, yeah, make sure that they're accurate, make sure if anything's out of parameter, that you notify your clinical instructor, the nurse, whatever, somebody right away. What else? I'm trying to think. And then med surge, I know, ooh, that is hot. Yikes. Okay. Did I break another battery? It's just like burning up. There we go. What else? Yeah, no med pass till after you take the med test. PO meds, you're probably okay on, but yeah, that should be okay. Med surge, you are what, with Ms. Dominguez on 3rd floor, so you've been there before, so that should be good. I don't know, because Sutlip's following her, so I don't know if it'll be the same with the documenting or not. It could be, but yeah, I don't know. I don't have an answer for that one. And then at Natividad, ARU, the rehab unit, and MedSurg 2, and then there's peds off of the rehab unit. So that'll be good. And Miss Heinrich has worked there in rehab, so she knows the lay of the land. She knows how the computer system works and all that. It's been a while for me, but I remember after orientation, I remember how to do it. I used to do the peds rotation, the peds clinicals, when we had peds clinicals, and we no longer have peds clinicals in the hospital. They're all community now. So, yes. I'm sorry, say that again. So generally in OB, it works better. Normally we would assign you to a patient. In OB, it works better to assign you to the nurse. The nurses are more apt to just have you follow them than to have you be with one patient. I don't know why, but that's what I've found. But your focus would be on one patient. You would choose one, say they have 3 patients, right? You would choose one that you would do a care plan, or that you have a client problem, or whatever it is that we ask you to do. The expectation is not 3, not the first day anyway. But you would more than likely, I know at SVMH and yes, at Natividad. So yeah, you'll follow a nurse who will have several clients. Now, if you're in L&D, that nurse is probably only going to have one patient. But the postpartum will generally have couplets, up to 3 couplets. Yeah, and so you are caring for a couplet. So you'd have mom and baby. Yeah. Yeah.
For regular message, is it okay? Yes, we have our one patient, we do all our documentation on that patient, but then we follow the nurses on the other.
That's it. Oh, they're over here now. Okay. That would be up to your clinical instructor. So I would say ask. Because Ms. Dominguez knows the lay of the land. I know Ms. Heinrich wants you to do everything, like to get the experience for everything. So for sure. Post-conference, I'm not sure. We're trying to get rooms, we're trying to get spaces to do that so that we can debrief after. What else about clinical? Yeah, Greg. Uh-huh. Yeah, so basically what you're going to be doing, so remember last week we did all the, and I'll post, like I said, I'm behind, I'm sorry. I gotta have everything else caught up and not that. Is we did development last week, right? And so we, looking at the developmental stages, looking at, I think most of you are probably going to want to be with infants. I'm guessing you might not want to be. I don't know. Just because you have a child. But looking at looking at the development. Bless you. Looking at how does the center meet developmental needs of the children while they're there? If it's the older children, are there any specific like activities or what are they doing and how does that relate to their growth and development? And it would be the same thing at the Hartnell daycare center, but you're going to be there in the morning and the afternoon so you can compare and contrast. Right before you were only there for like maybe 2 hours when you were in 47, and now you'll be there all day, so you can actually watch them eat. Like, how do they choose food? How do they eat their food? How do they share? How do they communicate, the kids? How do they communicate with each other? Right, looking at that kind of aspect. Does that make sense? And then there's like a reflection that you write for that. So they'll give you a tour. And then they'll assign you to one of the rooms. And for them, it's like an all day thing. So I don't know about compare and contrast, but like, for example, if you're in the infant room, there could be, a 2-month-old or no, 3-month-old maybe versus an 11-month-old, right? And you could compare and contrast that kind of, those kind of things. I don't know if that helps a little bit, but it's mostly the development. Not so much screening, but there might be a part to do about like what vaccines are, what vaccinations should the child have, things like that speak to development. Somebody else you did.
Will you send out a note where we're supposed to meet you tomorrow?
Yeah.
Okay, I have no idea where I'm going.
Park in the corral and then trek up there. No, we're gonna meet. I think we're gonna meet in the lobby. I think we're gonna have both groups meet in the lobby, just to corral in the lobby, and then figure out where we go from there. Yeah. So, and we don't get to change into scrubs. I'm so bummed. Usually OB you get to change into scrubs. I think SVMH still gets to change into scrubs. I was so bummed. Like, I want to change into scrubs, but yeah, but space is limited. So, but we'll do like a little tour and get y'all onto the computer and all that. But yeah, I'm figuring 6 o'clock in the lobby. What other questions? Yes.
We only need to take that one document, correct? The packet, the paperwork.
For where are you? With me? Yeah, the mother infant. Yeah. Well, everything else is available online, so you actually have it available to you all the time. What is everything else? I'm asking y'all, besides the clinical packet, right? The clinical portfolio tools, the caring, all that stuff, right? Because if you have a caring intervention and I say, ooh, that would be a great example of advocacy, you can pull it up online, right? So you have that always available to you, right? But yeah, the checklist, yeah, or the worksheet, yeah. And I don't know if Ms. Clark's gonna have you do the whole thing. I usually have you do pieces, parts. It's kind of whatever speaks to you. Yes.
For coastal kids, we call them today.
Yes.
Okay, just want to make sure.
Yes.
I
think
there's two numbers on there, one for the main line for the clinics and one for.
Yeah, try the main line,
Okay.
I think.
And just let them know I'm coming tomorrow.
Yeah, and ask them who you're supposed to meet with, because sometimes instead of meeting at the coastal kids area, say you had to go to Santa Cruz, for example, you may meet in Santa Cruz and start your day there, and then move your way back. But then sometimes it's no, meet at the coastal kids office and then go from there, depending.
Okay.
Because the cases can be wherever. That's fun. I miss home care sometimes. I used to do pediatric home care. What else? I'm trying to think what else I had on my list. I had that. Review week 2, review week 3, plan ahead for week 4. What's coming up in week 4? Quizzes and everything. Sorry. It'll prepare you for the exams, right? Oh, where is my, not what I'm looking for. Oh, I know. I found my newborn book for like variations. So like it has all kinds of different, like the Epstein's pearls and conjunctivitis and all that kind of stuff. So if people want to look at that. This is actually from when I was in nursing school. This was a book that we got in nursing school. So this is, this is ancient. They don't even make it anymore, I don't think. I don't know. It's Meat Johnson. So it's a formula company. I have no idea. Accessory nipples, Mongolian spots, neonatal teeth, thrush. Oh, there's your Epstein's pearls. So yeah. So anyway, so there's that. If people want to just make sure I get it back in one piece, please. Do you want, what did I do last semester? Was it assignments? What calendar did I make for you? Tests, quizzes? Huh? Yeah. Because I can put one of those, I think it was like a cross section, so like it showed you when all the quizzes and exams were. I can do that again. We have all the syllabi. Is, you know, you look for something and then you can't find it. That is not it. Oh, that's what I was looking for. There we go. So week 4, we're going to talk about normal newborn adaptation. So we talked about, we did the newborn assessment, right? So we're going to talk about newborn adaptations, how the baby adapts from being in utero to being born out of utero. We're going to see reconstitution should be done first, or we can finish up on reconstitution. We're going to look at vaccines and review IMs and sub-Qs like injections, bring your injection pads and practice on that. And we'll probably add in the medication portion of the IV push, right? We just did saline flush, but now we can actually give you medications and you can look up over how long a period of time you're supposed to push the medication and practice that as opposed to just the flush. Problems in pregnancy will be Ms. Clark. And then we're going to go over, review some of the endocrine meds. So some of the ones that Ms. Clark will go over, but add some others to that as well, and sleep meds. That's what it looks like for week 4. Yeah, week 5, no class, pain, delivery, yeah, labor, pain, and testing. communication skills. Because we don't have a class on that Monday. So that's our 4-day weekend. Yay. And we will put out a question distribution for the exam as well. So you know kind of what to expect for that. All right. Anything else? If not, you good? All right. So you are responsible to let me know what's going to help you. Yes? Okay. You put it in the put it up in the Q&A. Oh my goodness. Do your pre-course reflection, due next week. It's like 10 sentences, 2 paragraphs, five sentences per paragraph, right? 1 answer per question. What? I don't know. 1 sentence. Yep. 1 sentence per question. All right. So Zoom, not sure who iPhone is. Hi, iPhone. But we are done. And so I will do I will post the recording. Thank you.
I don't think so. I know.